Hello everyone, welcome back to my channel. This is Dr. I Says, the doctor that knows and knows that he knows. You know, I want to talk on 4 things that every woman in their reproductive age must know. They must know this. They are just simple things. And any woman that is in a reproductive age, a woman that has started seeing her menses, that she must know. Number one is she must know her LMP. Just imagine a woman present to you at the clinic and you're asking her what is your LMP and she say, what is that? As like the word LMP means your last menstrual period. You ask her, madam, when last did you see your period? And she's lost. It's not supposed to be any woman in a reproductive age is supposed, you are meant to, as a follower of Dr. Isaacs, you must know. And that is why we are reacting together. That is why we are here together, so that our sex can be completely and fully high. You know, you've got to know. Now, when you are asked what is your last menstrual period, it's not the day you ended your menses that you say no, not the date. If your menses started on the 3rd of October and ended on the 8th of October, your last menstrual period is that on the 3rd, not on the 8th. Did you get that? Now, friends, if you don't know by any reasons, another thing you must do is that you must do an early scan before 14 weeks of pregnancy. You must do an early scan so that if you cannot provide your LMP, as a doctor, they can use this to assess the EGA of your pregnancy. The word EGA means estimated gestational age. But if you don't know your LMP, not for you, you as a follower of Dr. I Says, a subscriber to Dr. I Says, you must know. You must. You have to know. Take notice of it. Another thing that you must know is that you must know the importance of folic acid. Yes. It is expected that any woman in a reproductive age that intend getting pregnant must start taking folic acid at least 3 months before the conception. This is simple. It's simple. Folic acid, because you want to prevent chromosomal abnormalities. Folic acid, because you want to prevent mixed abortion. Now they say, okay, now they say we should not be using the word abortion again. Miscarriage. That people tend to believe that the word abortion, but they are still the same thing now. And when you tell the patient, sorry, you have abortion, say, abortion could be spontaneous or induced. But now they are saying we should not use the word abortion, use miscarriage. You need folic acid to prevent miscarriage. You need folic acid to prevent spinal bifida, any other form of abnormalities, anencephaly. You need folic acid. These are big names. It's simple. What they are asking every day. If you're in your reproductive age as a woman and you intend, your sister is in a reproductive age, she intend getting pregnant 3 months before pregnancy, she should be taking one tablet of folic acid every day. You got that right? As a woman in her reproductive, you must know this. Another thing you must know, which is number 3, you must know your menarche, which is the first menses you ever had as a beautiful young lady. Anytime gynecological history is taken, this aspect must be asked. Madam, when was your first menses? Some tell you, doctor, that is not. One woman told me, you expect me to remember that? But as a follower of Dr. Hisense, try have this at the back of your mind. As a woman, anytime, or as a husband, anytime your wife goes to the hospital, they must ask her all this. And she needs to know them for a lot of reasons. Number 4 is that as a woman in her reproductive age, you must know your resource factor. And that is a big topic on this. One of these days, we will sit down and discuss all of this. Right? Yesterday, the nurse called me and said, doctor, this woman is resource D negative. Would there not be need for us to give her immunoglobulin? I don't want to mention the specific name. I said, of course, there will be need, but I said, but what is the resource factor of the baby? And she said the baby is negative. I said, well, if the baby is negative, there is no need. The resource factor of a woman is negative, and that of the baby is positive. That is when there is need for immunoglobulins. Friends, as a woman, you must know your resource factor. A woman in your reproductive age, these 4 things I've enumerated. Every day in the hospital, we meet with all these things. As a follower of Dr. Hisense, I told you that I'm going to be bringing it to you one after the other. You must know these things. Know them. Your last menstrual period, when you attain menarche, the importance of folic acid, and your resource factor as a woman. You need to know them because we will ask you. If you go to the hospital, when they ask you, don't fall my hand, though. You need to know. You must not fall my hand. Or you'll be told that these are things that are required from you. Thank you, guys. I love you. As they are coming, I will be bringing it to you the way they are. You have a wonderful time. Enjoy your day. Bye.